and provide context behind the Rotary Family Health Days. From the SANAC perspective, however, the Rotary Family Health Days have been an extremely useful platform through which we facilitate the provision of HIV and TB services to disadvantaged communities, especially those who are within hard-to-reach pockets of the country. Following the launch of Cheka Impilo National Wellness Campaign by President Cyril Ramaphosa in his inaugural State of the Nation address in 2018, the Rotary Family Health Days became an excellent conduit to leverage on for SANAC and its partners in leading the Cheka Impilo campaign. The 3-day Rotary Family Health Days were instrumental in reaching vulnerable populations within their setting. The partnership with the Rotarians is one that South Africa values greatly. At this juncture, ladies and gentlemen, please allow me to introduce the Honorable Deputy Minister of Health, Dr. Joe Phaahla. Appointed as Deputy Minister of Health in 2014, Dr. Phaahla has served as Deputy Minister in various portfolios, including arts and culture, as well as rural development and land reform. Dr. Phaahla is former Director General for the 2010 FIFA World Cup Government Coordinating Unit and CEO of the South African Sports Commission. Dr. Phaahla was a member of the Provincial Executive Committee of the African National Congress in Limpopo Province from 1991 to 2001. Before the unbanning of the ANC in 1990, he served in leadership positions in various mass democratic movement structures, including the NEC of the United Democratic Front. He has also served as MEC in various portfolios within the Limpopo province, and these range from education to sports and culture, as well as health and social development. Dr. Phaahla is a qualified medical practitioner with an MBCHB obtained in 1983 from the University of Natal, and he has practiced in various hospitals in KwaZulu-Natal, in Gauteng, Mpumalanga, and Limpopo until 1994. Ladies and gentlemen, please welcome the Honorable Deputy Minister of Health, Dr. Joe Phaahla.
Sorry, Dr. T, I'm not sure where the doctor's got to. He's not logged in yet. Can we switch around and let Sue do her presentation while we wait for him to get on to log in?
Sorry, David?
I said Dr. Phaahla has not logged in yet. So perhaps Sue can do her presentation and we can switch them around.
All right, so let's... Sue.
Okay. Oh, sorry, we found him. Hang on. Here we go. Right.
Hello. Hello.
Right.
Yeah, the problem is you have muted me. Somebody has muted me. I can hear somebody there saying I'm not present and I can't respond because my microphone is muted. Thank you very much.
It's no longer muted.
Yeah, no, thank you. Thank you very much. Can you hear me? Program directors? Am I audible? I'm muted.
Yes, you are. Yes, you are audible.
Okay, thank you very much. I was getting frustrated because I'm looking at the program directors and I'm told I'm not available. But thank you very much. I think we're all learning from this technology. Let me recognize my colleague there, the Minister of Health, Dr. Zweli Mkhize, MEC from Western Cape, MEC Mbombo. I'm told she should be on the platform. The CEO of Action Group for Family Health and AIDS Prevention, Ms. Sue Puckett. We've met, I think we're together in the previous ceremony at Beggarsford in Limpopo last year. Deputy Chair for SANAC, Ms. Litike Steve. Country Director for Center of Disease Control and Prevention, Dr. John Blandford. The Global Rotary CEO, Dr. Ian Button. The SABC Board Chairperson, Mr. Makatini. Rotary International President-elect, Mr. Shekta Mehta. Our program directors, already recognized colleagues, ladies and gentlemen. I'm indeed very honored to be on this platform. As I've already mentioned, I'm indeed very pleased to have been associated with the Rotary Health Day on a number of occasions, as already indicated by the introduction by the program director, one of the program directors, to say that Dr. Tembisi Lekulu, that I've been in the portfolio from 2014. I've participated in a few of the Rotary Health Days, including the last one in Limpopo last year. Now, since the inception of this Rotary Health Family Health Days in 2011, in a number of countries beyond just South Africa, over 2.2 million clients have been offered services, has been serviced, being offered more than 10 million free health services. In South Africa alone, more than 230,000 people have benefited and received more than 750,000 services. The collaboration between the Department of Health and the Rotarians is in the form of public-private partnership to deliver comprehensive health services and wellness screening services to multitudes of communities, and most of the time in the underserved communities in rural and township areas. The free health services usually on offer include, amongst others, health screening, testing, and referral for a variety of ailments, including HIV, STIs, TB, hepatitis B and C, malaria, diabetes mellitus, blood pressure and heart disease, and also screening for some of the cancers. Also offered is deworming, vitamin A supplements, and immunizations for polio and measles. These are also usually provided during the health days. To add on to these services, also often available optometric services, checking the eyes and providing spectacles, audiology, testing the hearing, dental examinations are also included depending on the needs in various localities. Mental health counseling, educational and referral services for follow-up and care are usually also provided. Distribution of male and female condoms, hygiene packs, eye readers, dental cleaning supplies, as I mentioned already, and other materials are also offered to clients depending on the needs and availability, depending on which areas the program is being held on that particular day. The program, initiated by Rotarians for Family Health and HIV Prevention, has included volunteers, healthcare workers, and also NGOs who have worked with hundreds of Rotarians in more than 150 sites across the country. The Rotary Family Health Days program is a significant contributor to the prevention revolution by providing a platform where the Department of Health and its implementing partners, together with other partner organizations such as media houses, and therefore we're very pleased to have the chairperson of the SABC board with us today, private sector funders and others to operate together and are fully on board to maximize for efficiencies. We are pleased with the results of this program for the past almost 9 years now, and this activity has become a permanent feature within the health calendar of events in South Africa, and many communities identify very fully with this program, and many communities look forward to when this program comes to their area. Finally, I want to add to say that we are encouraged by this ambitious initiative, as it is indeed in line with the strategic objective of our department, the National Department of Health, and all our colleagues in the provinces, and that of government as a whole, in terms of the strategic objective of which being the achievement of a long and healthy life for all South Africans. And also, this is also articulated in our medium and to long-term plan, the National Development Plan. And this is also in line with our National Strategic Plan for the Department of Health, 2017 to 2022. Program directors and ladies and gentlemen, I would want to, as I conclude, call on our people. We know where we're still in, we're not yet out of the woods with the COVID-19, and we are conscious of the fact that as a result of this pandemic, there'll be many challenges in terms of access to health services due to focus on the pandemic, but also due to various hindrances in terms of people accessing the service. We want to appeal to all our people to say, as we now have been easing the lockdown and the restrictions, we call on all our people to please come out and use our health facilities, all our health services, which we are managing, and also programs such as this Rotary Health Day. Let me also thank all our healthcare workers who have been in the front line and without whom we would not have been able to manage this pandemic up to this stage, where we see a serious reduction in the infections. Lastly, let me wish this Rotary Health Program a long and successful lifespan. Thank you very much, ladies and gentlemen, and the program directors. Thank you.
Thank you very much, Honorable Deputy Minister, for those warm welcome remarks. We will now invite Sue Paget to give us an address. And Sue Paget identifies closely with the Rotary International motto of service above self. Sue's first connection with Rotary was in 2000, when she was contracted by Rotary International to work in South Africa on the polio eradication private sector campaign, working with Rotary leadership, government, and corporations in South Africa. Subsequently, Sue was invited to join the Rotary Club of Johannesburg, and that was in 2002. And she joined the club as a volunteer, and over the years, worked on various campaigns in project management capacity. During this time, Sue met Marion Buch, the founder and CEO of the Rotary Action Group based in Atlanta, Georgia. Sue was then appointed the director of African Network for Children Orphaned and at Risk, a program that is located in Africa, which aims at supporting orphans and vulnerable children in Africa. Sue was also appointed by the board of the newly named Rotarian for Family Health and AIDS Prevention in the United States during October 2012. In January 2019, Sue was named the global CEO of RFHA, still based in South Africa. She is currently responsible for the oversight of 8 countries conducting the Rotary Family Health Day program and the pilot launch of the RFHDs in countries like Lesotho. Sue has been graciously acknowledged and awarded by Rotary for her work. And Sue also, outside the Rotary sphere, hold a number of portfolios. Kindly join me in welcoming Sue Paget. Over to you, Sue.
Thank you, Dr. Makanya. All protocol observed. Almost 10 years ago, in a village in Uganda, hundreds of Rotarians, including past district Stephen Wanji, who is with us today, and RIFA founder Marion Bunch, were awake before the sun, coordinating last-minute checklists as they waited to see whether the surrounding communities would show up to receive the free health care they had planned for the first time. As the sun tracked across the sky that day, over 38,000 Ugandans queued for free screenings for diseases, including HIV/AIDS, TB, diabetes, blood pressure, immunizations, and more. The Rotary Family Health Days were born. This pilot was the first stepping stone on a journey through which we have confirmed 5 things. 1, that Uganda and many other countries needed community-specific health interventions. 2, the integrated health screenings allowed people to come forward for testing without the stigma that might be associated with singular screening. 3, that the people using these interventions believe Rotary to be non-partisan or neutral, and therefore trustworthy. 4, that health delivery and funding partners contributing to these interventions believe the same. 5, that driven by service leadership and volunteerism, Rotarians are happiest when working together on a common cause directly benefiting their country. Minister Mkhize, greetings to you, Sanibonani. It is a real privilege to have you and so many important people attending this webinar today in the spirit of our 9-year partnership, and to Sheikh Amita from India, our incoming international president. Welcome. Members of the public join Rotary because they're driven to take action and to create lasting change. In the 11 countries in which the Rotary Action Group for Family Health and AIDS Prevention, or RIFA, operates, a network of over 2,000 Rotarians and partners meet across hundreds of clubs to drive our annual Rotary Family Health Days. In South Africa, Health Days happen each year in October, and indeed, today's webinar is a marker for what would have been our 8th Family Health Day in this country, were it not for COVID-19. Free health services at multiple sites are offered for both communicable and non-communicable diseases, the availability of which we do our very best to secure through fundraising and private sector partnerships. In South Africa, we have been privileged to have the high-level partnership with the National Department of Health, where all core HCT services are donated. In addition to this, we work with over 95 NGOs at site levels to offer these additional services. In time, we will hopefully, through our strong model, be able to work with our partners to administer Ebola and COVID-19 solutions. We have worked with so many different stakeholders in so many different countries during this journey to achieve proof of concept. I would be remiss if I did not mention the important role the South African Department of Health and the Centers for Disease Control and Prevention have played in helping RIFA to develop our robust monitoring and evaluation system, which is now being implemented globally and continues to improve. We have been able to document having served over 2.5 million people with over 11 million health services since inception globally. The system, which is constantly evolving, means we can measure what we do in 11 countries, including tracking linked to care through our follow-up impact studies. The Rotary brand also enables us to work with and bring together all sectors of society and countries where the health days take place. These include governments, private sector, media, and civil society. RIFA is the convener of the program. Somebody needs to hold this partnership together. Rotarians, governments, private bodies, media, and NGO partners donate services and materials, offering a 45-to-1 return on cash that's contributed, which equates to 3% of total value. So far, so very, very good. But what now? It is a distressing fact that 3.5 billion people, half the world's population, most of whom live in Africa and Southeast Asia, access to affordable care, health care. And that's a pre-COVID-19 figure. The COVID-19 pandemic will have a long-term impact on all aspects of healthcare. Economies have been hard hit, money is tight, and priorities have shifted. Our own work has been similarly disrupted. But the resilience and tenacity which has gone into developing our model over the last 11 years has not been affected. We are using this time to reflect on what we need to do better and prepare for the challenges ahead. In addition to all this, there is going to be the need to roll out a COVID-19 vaccine as soon as it becomes available, which in our context means reaching into many marginalized and distressed communities. Our core learnings will serve us well in this regard. The value of partnerships. Through RIFA, districts, clubs, Rotarians, and Rotractors can become part of a larger and more comprehensive response to disease prevention. And through RIFA, large, multi-sector, multiple country, public-private partnership programs can work powerfully in disease prevention and response. We believe that these partnerships will be critical in building back better. We are here to play our role in that rebuilding. Siyabonga. Thank you.
Thank you so much, Sue, for sharing that history of the Rotarians in South Africa. It's certainly heartwarming to hear the commitment, I'd say, and the reaffirmation of the service leadership and the volunteerism. And we're certainly looking forward to reaching many more South Africans in partnership with the Rotarians as well as with our stakeholders. Ladies and gentlemen, please allow me to introduce our next speaker, Ms. Steve Letsike. Ms. Letsike is a well-known activist, not only within the LGBTI sector, but also on issues of feminism, human rights, and social justice. Among other roles, she currently serves as the Deputy Chairperson of SANAC, a seat that represents the voice of civil society within the SANAC structures. She also co-chairs the National Task Team on Hate Crimes, an initiative by the Department of Justice and Constitutional Development. Ms. Letsike is the founding director of Access Chapter 2, a human rights organization with a specific focus on LGBTI populations and issues of gender equity. She has previously worked with Anova Health, Open Society Initiative for Southern Africa, and the Department of Social Development. Please welcome Ms. Letsike.
Thank you so much, Program Director. I hope you can all see me and hear me. I'm not sure if you can. Okay, I'm not sure what is wrong. It could be my screen, but I think maybe hearing might be even much better. Colleagues, let me appreciate this invitation. And first to recognize the Minister of Health, the Deputy Minister of Health, MEC of Health, and also to congratulate the President-elect of the Rotary International, Mr. Mkhize, and also to recognize all of you in attending this most important event, colleagues. Of course, with the aim of improving the family health and the prevention of HIV and AIDS, you know, South Africa enjoys the partnership, the long-standing initiative, you know, with Rotary, you know, to really improve the health of families, you know, across the country and of course, globally. And Rotary work seems to reached out and connected to many marginalized communities who are in need, you know, and also not just for services, but for critical health information and resources. It is no doubt that the work done by Rotary, it's needed and needs to upscale, even in the quest of challenges that we are experiencing. Program Director, I want to say as civil society, we continue to express our appreciation for this work, and we affirm our commitment as civil society, but also on behalf of SANEC family, that the partnership with Rotary, it's a partnership that affirms even our national strategic plan that prioritize prevention, treatment, addressing social and structural drivers to address HIV, TB, and STIs, but as well as ensuring a collective effort that speaks to shared responsibility and accountability. I wish to just bring few things that we need to consider as a family joining efforts with Rotary. This on its own as part of the essence to address the private-public partnership, with the Rotary Family Health Days, addressing even additionally the COVID-19 prioritization. And again, during the year of nurses and midwife, what we affirm as civil society that we stand for, it is the universal health coverage that is a priority and key for us. And we are really commending the work done by the ministry, led by the Minister of Health, in ensuring that universal health coverage is still a desired outcome that we want to see, part of which is the NHI that needs to be advanced. What is key for us as civil society is to address some of the nuances that sometimes makes it a bit difficult for other marginalized communities to be addressed. Looking at the issues of how the current healthcare modeling still delivers service in a heteronormative way. And I'm really calling wholeheartedly that we diversify our service delivery and we ensure inclusivity and diversity in our delivery of services. We need to ensure that gender inclusivity to address the complexity even of gender diversity, even in the public health sector. It is quite important that we champion the development of tailored and differentiated programs that speaks to all South Africans and those in South Africa, not just even a complexity of a nuclear family modeling. It means that we need to diversify wholeheartedly. And I'm calling on the partnership to ensure that inclusivity. Again, on other issues that we need to think about, it's around tailored services that have been delivered by global donors. And I'm really quite excited to see global partners and development agencies that are part of this event, which have predominantly contributed to the fundamental programming of key population, while we have seen some of these gaps that existed in the public partnership. So I'm really saying that we should never fail the marginalized communities. We must reach to all of them, whether abled or disabled, whether gay or lesbian or trans or heterosexuals. We must reach everyone, young and old. Others, it's also to ensure that sex workers are not also left behind. And I'm raising this particularly because sex workers often can be left behind or targeted individually, forgetting that they also have families. We do want to ensure that those services that we've committed to saying we are improving, we improve for everyone. The commitment that our government has done is commended, but same as the commitment done by Rotary in this partnership. So we commend and we affirm our commitment and partnership in this work, and we're calling that we all work together to ensure that we reach many. Thank you so much, Program Director.
Thank you, Deputy Chair Steve, for your address, and which really affirms commitment to universal health coverage, and also emphasize the need to access by all sectors of community to services that are tailor-made to their needs. I will now invite the incoming country director for Center for Disease Control and Prevention in South Africa, John Blumford, to come and give us an address. John Blumford has been named US CDC Country Director and DGHT Program Director for South Africa. Dr. Blumford currently serves as a US CDC Country Director in Vietnam and HHS Country Representative to Vietnam, where he provides overall leadership for CDC broad program portfolio in HIV, global health security, tuberculosis, influenza, and immunization. Previously, Dr. Blumford was Principal Deputy Director of CDC Division of Global HIV and TB at CDC headquarters in Atlanta, USA, where he oversaw CDC's Global HIV and Tuberculosis Program and the division's approximately 2,000 staff positioned across 45 country offices in the Atlanta in support of PEPFAR. He served as a division director during the period April to October 2014, and Dr. Blumford's technical leadership at CDC and within PEPFAR was critical in elevating the role of economic research and analysis to support planning, sustainable scale-up, finance, and efficient implementation of global health program. For 2 decades, Dr. Blumford was seconded to the Department of State Office of the US Global AIDS Coordinator, where he oversaw implementation science activities across multiple US government agencies and led efforts to project global resources needed to scale up the PEPFAR program. He studied at University of Texas, Austin, and the University of Notre Dame, and he conducted postdoctoral research at the University of Chicago as a Social Science Research Council Fellow. John will be accompanied at post by his husband, Thomas Pomeroy, his partner of 25 years. Over to you, John. Thank you for addressing us.
Thank you, Doctor. Good evening, Huyanand, Sanibonani, and thank you for inviting me to be part of the Rotary Family Health activities this year. I deeply regret that my inaugural involvement with the team here in South Africa is not with you in person in the field, but I'm sure that time will come in due course. I'm proud to be part of an esteemed lineup, and I acknowledge the presence of the Minister of Health and the Deputy Minister of Health. And please consider all protocols observed. I thank the organizers and the linchpin partner, RIFA and Rotary South Africa, for inviting me to give a message of support on behalf of the US government as one of the partners assisting this important initiative. 3 US government agencies, the Centers for Disease Control and Prevention, the US Agency for International Development, and the Peace Corps work together to implement the US President's Emergency Plan for AIDS Relief, PEPFAR, here in South Africa and contribute to the success of your initiative. The RFHD campaign is an innovative effort to respond to the specific challenges in South Africa in a dynamic way by establishing cooperation across several key sectors through the formation of smart partnerships that combine different kinds of expertise, experience, and networks. Although COVID-19 has substantially changed the posture of implementation on the ground, I have no doubt that the RFHD team will adapt to implement changes that impact lives in a positive and sustained manner. The interdependent partnership model in place on the Rotary Family Health Days has allowed CDC and other US government agencies to be heavily involved in this effort from the beginning. On a personal note, I was pleased to have engaged in this partnership as it was being established while I was working in earlier roles at CDC headquarters in Atlanta, USA. And although the program was initially developed to address the critical issue of HIV in Africa, what makes it unique and strategic is that it has expanded to focus on strengthening comprehensive health prevention and screening services through offering TB screening, the provision of condoms, diabetes and blood pressure screening, measles vaccinations, among others. This is also the goal of the PEPFAR program, which is to comprehensively address HIV through the most impactful evidence-based interventions. Broad access to HIV testing and linkage to effective HIV treatment that both saves lives and is now demonstrated to be our single most effective prevention intervention. Voluntary medical male circumcision, condom distribution, and so on. Currently, healthcare facilities in the country as a whole are focused on COVID-19. But we can't allow the ripple effects of COVID-19 to erase the hard-earned progress that South Africa has made so far in terms of healthcare. More than 5 million people are living with HIV are on life-saving preventing treatment here in South Africa. That's an enormous feat, and it reflects years of coordinated efforts across sectors. And most importantly, the primary reason we cannot hold back current and future efforts to achieve HIV epidemic control. While in this year we've not been able to stand side by side in the field as communities access this vital resource, I look forward to doing that next year. And I hope you know I view these screenings as a step in the right direction towards achieving an AIDS-free generation in our lifetime. And I will be happy to support this in person as soon as COVID allows. Thank you, Siyabonga, and Nisale Hakle.
Thank you, Dr. Blanford. We certainly look forward to seeing you in person very soon. Siyabonga, Nat. Ladies and gentlemen, please allow me to introduce our next speaker, Dr. Ian Barton. A committed South African, Dr. Ian Barton is a medical doctor with 10 years experience in clinical practice and 20 years in healthcare business management, specializing in pharmaceutical supply and market shaping startups. Dr. Barton's most recent role has been as Executive Vice President of Healthcare for Imperial, Africa's largest pharma supply organization. Dr. Barton was responsible for developing the concept of regional distribution centers to support the scale-up of PEPFAR and of the supply chain control tower that supports the Global Fund's pooled procurement mechanism of antiretroviral therapy. Other innovations developed under Dr. Barton's leadership include the Unjani clinics, Warehouse in a Box, Clinic in a Box, and SSIH, which is a mega distributor model enhancing medicine access across African markets. Dr. Barton has served on the advisory boards of Merck for Mothers, South Africa's Public Health Enhancement Fund, People That Deliver, and the African Resource Center. Welcome, Dr. Ian Barton.
Thank you very much, Honorable Minister Dr. Mkhize, Honorable Deputy Minister Dr. Pashla, Honorable DG Dr. Buthelezi, Rotary leadership, colleagues and friends, good evening. The Rotary Family Health Days offer a compelling insight into the potential for health days to increase access to care. And as it is done by Rotary, it is in the community, by the community, for the community. I'm pleased to confirm that the Clinton Health Access Initiative, or CHI as it's better known to many of you, looks forward to collaborating further with Rotary to establish areas that could strengthen the model and expand its use. Many people still struggle with access to quality, affordable healthcare. Many more visit their healthcare professional at a stage of disease that makes improving their health outcomes more difficult. Health days support health systems in reaching people and reaching them earlier. In addition, disease prevention and increased self-care have got a magnificent benefit in helping address the global challenge of the longer-term sustainability of health systems. Healthcare models that take healthcare to communities to help close gaps in access, such as the River Family Health Days, are now even more important than ever. The current COVID-19 pandemic has disrupted access to healthcare, with vaccines coverage across low and middle income countries dropping to levels from 25 years ago, and HIV, TB, and malarial programs facing disruptions. In immediate response, CHI is very pleased to be able to support the South African National Department of Health with EPI catch-up in 12 districts across the country. Partnering health days with offerings that build self-care capability and awareness into the design empowers individuals, it empowers families, and most especially it empowers mothers to make healthier choices for themselves and their families, and it helps prevent disease. Fundamental to patient empowerment is the concept of health literacy, and less formal engagements such as those seen at health days are extremely effective in developing individual and community health literacy. RIFA Health Days align services with existing national health strategies and the priorities, and build strong integration into the existing healthcare services for ongoing evaluation of cases, treatment, and follow-up. But these health days can also play an invaluable role in the training, the deployment, the exposure, and the development of credibility of community healthcare workers. Health days can even support the evolution of science. Annual follow-ups can also evaluate long-term impacts on health outcomes and even enable longitudinal research on health in communities. Specifically, we admire RIFA's understanding of the importance of the utilization of technical solutions and data to enable effective and timely follow-up with participants. The COVID experience has shown us all that significant numbers of people want to be empowered through access to electronic information and guidance, and even to hold their electronic medical record in their hand. Mobile systems can enable community health workers to access certain elements of health records and can enable the participants to know and measure their own progress for relevant health goals and for biomarkers. So as CHAI, we are very proud to be associated with RIFA's Family Health Days, events that are clearly focused on three main objectives: increased access to quality, affordable healthcare, improved health outcomes, and individual empowerment for health. Thank you for allowing us to participate.
Thank you so much, Dr. Bunton. We are quite encouraged about your commitment to partnership that would ensure catch-up plans across the range of essential services that were affected about the impact of COVID-19, especially your commitment in working together in partnerships in developing service delivery models that would assist government sustain essential services in the context of COVID. Thank you very much, Dr. Bunton. Our next speaker. Sorry. Honorable Minister and Deputy Minister and guest, can I now take the opportunity to introduce Mr. Makhathini. Mr. Makhathini is the chairperson of SABC board and is highly skilled, multi-talented, and experienced board chairman. Transformation, legal, corporate governance, corporate affairs, and business leader with 21 years strategic operations and management experience, leading and managing large business units, teams, departments, and companies in the private and SOE sectors. Her educational background includes general management program, which was obtained in Harvard University, MCOM business management, BA honors degree, BPed degree, measuring in geography and business management, diploma in HR management, and certificate in finance and economics. And her experience is summarized as a chairperson of the board of SABC, executive board member of British American Tobacco South Africa, an executive board member of the South African Breweries, board member SAB Thrive Fund, board member Eguruleni World Outreach Center Advisory Board, Board Member Sports Trust Board, Board Member Industry Association for Responsible Alcohol Use, President of Convocation at the University of Zululand, Member University of Zululand Council, and a member of the Student Representative Council. Allow me to welcome Bongumusa Makhathini to address us. Over to you, Papash.
Thank you, Program Directors. Thank you for the opportunity. The Honorable Minister of Health, Honorable Deputy Minister of Health, MEC of Health Western Cape, HODs and other representatives from the Department of Health, President-elect of Rotary International, members of Rotary Fraternity, members of USAID and PIFA, esteemed leaders of foundations, corporate civil society organizations present, and our own SABC Foundation Committee. Good evening. The South African Constitution guarantees every citizen access to health service through Section 27 of the Bill of Rights. Yet, many South African citizens remain largely lacking access to basic healthcare today. The situation is further aggravated by the lack of accessibility to life-saving information, particularly in the context of the multicultural South Africa, where we are afflicted with a multitude of diseases that threaten the well-being of our citizens. It is widely acknowledged that the SABC plays a significant role in the dissemination of health information in South Africa. Many simple diseases often go undetected until it is too late, out of lack of information. Therefore, it is imperative that we communicate health issues frequently and extensively, and in as many diverse languages as possible to prevent miscommunication and subsequent unnecessary loss of life from preventable ailment. With health as one of our key pillars as the SABC corporate social responsibility, the corporation has provided educational content on health matters designed to inform the public of their right to health through our TV, radio, digital platforms for years. It is for this reason that we applaud the Rotary Family Health Day effort of saving 2.5 million citizens with over 11 million worth of free health service. With the correct and timely diagnosis, we believe that as a country, we can finally defeat the many illnesses that plague our communities through initiatives like those offered by Rotary Family Health Day. COVID-19 has taught us many lessons as the public broadcaster. However, one of the most significant has been the power that effective communication can have on saving lives and eliciting positive behavioral change. The SABC's partnership with Rotary Family Health Day form part of the public broadcaster's vision and mission to serve the interest of South African citizens from all walks of life. But it is also appropriately aligned with our government's National Development Plan of 2030 and the United Nations Sustainable Development Goal, which speaks to the provision of quality health care for all. Therefore, on behalf of the board of SABC, I would like to express my sincere gratitude to the Rotary Family Health Day for your contribution to the well-being of the public. May the partnership we enjoy continue to bring accessible screening and testing closer to more South Africans in order to reduce the number of citizens who succumb to preventable illnesses that could have been treated had they been discovered early. I thank you.
Thank you so much, Mr. Makhathini. The partnership between the state broadcaster and I think this partnership with the Rotary Family Health Days is critical in making sure that the public, especially those in marginalized communities, actually remain informed and are able to get access to services. So as a Kulu, ngizoti Babashe Makhathini Donda wasenkweleni kuhla phansi njengekhiwa ndlovu. Please allow me to introduce our guest speaker, Mr. Shekhar Mehta, who is the Rotary International President-elect for 2021 and 2022. Shekhar Mehta is only the 4th Indian in 115 years to be nominated as President of Rotary International for the year 2021 to 2022. A keen academic, he graduated from St. Xavier's College and has the unique combination of a master's in commerce, a qualified chartered accountant, a cost accountant, and a company secretary. He heads the Skyline Group, engaged in real estate development in different parts of India, including the largest group housing in the estate of Rajasthan. He is a member of many professional, cultural, and charitable organizations. Shekhar Mehta joined Rotary in 1985 and is a member of Rotary Calcutta, Mahanagar. He has served as a director on the board of Rotary International from 2011 to 2013. While serving as a Rotary International director, he helped Rotary to add 2 countries to its fold, and those countries are Bhutan and the Maldives. Keenly dedicated to service, Shekhar Mehta has led many service initiatives in India and in South Asia. He will serve as the world leader of 1.2 million Rotarians in 200 countries and geographical areas in the year 2021 to 2022. On behalf of everyone that is gathered in this commemoration webinar, I'd like us all to wish the President-elect a wonderful happy birthday and thank him for actually taking his time to come and share this time with us when he could have been out there having fun with fun people. Welcome, the President-elect, Mr. Shekhar Mehta.
Thank you, and a good day to everyone. It's absolutely my privilege and an honor to be with all of you on a very important day, a commemoration event for the Rotary Family Health Days, which has been doing some real good work in South Africa and the other countries in Africa. I compliment the person whose brainchild initially it was, Marion Bunch, and the CEO currently, Sue Paget, for taking the program from strength to strength over the years. Unfortunately, this year, we will not be able to have the Rotary Family Health Days. That's because we are right now struggling with the greatest issue that has afflicted mankind recently. COVID has really brought the world down to its knees. We are not sure till when it's going to continue, and it has disrupted so many of our other programs. Family Health Days and many other health programs have got disrupted across the world and definitely in South Africa and the other regions of Africa. But okay, this gives us time to, I would say, rethink what our strategy is going to be, and it gives time for us to sharpen our axe. And that's what I think today's event is going to allow us to do. I'm very happy that the Minister of Health as well as the Deputy Minister of Health both are present here. Let me begin by sharing some information about Rotary. As has been mentioned, in about 200 countries, a 115-year-old organization. For the last 35 years, our corporate program has been eradication of polio. So 35 years back, 35 years back, there were 350,000 children getting afflicted by polio. This year, fortunately, or I may say even unfortunately, 150 have been afflicted. So over the years, more than 5 million children, their lives have been saved either from getting crippled or they would not have lived at all. So this has been our program, the corporate program, started, it was in more than 125 countries. Now it remains only in 2 countries. We are happy that just last month, the Africa region was declared as polio-free, Nigeria having been declared as polio-free. So which was a major milestone in our fight against polio. And to understand that polio is only the 2nd vaccine preventable disease ever to be eradicated in the history of mankind. We feel humbled. We do take a bit of pride that yes, this is something meaningful we have been able to do. And similarly, in other areas of healthcare also, we would like to do major work. And the Family Health Days program in South Africa, as well as in the other parts of Africa, 8 other countries, has been hugely successful. And I'm sure it is going to see more success in the future. So apart from the health programs, there are other areas of focus where Rotary works, and let me just touch a little upon them. Basic education and literacy. There is economic and community development. Very recently, we've added the environment, peace building and conflict resolution. These are some of the areas that we do work, apart from, of course, working on health issues of mother and child care and preventable health diseases. Some major work is done in Asia as well as in Africa. But we would want that this work gets a further boost, especially working with the government. And I find that any program that has to be of a national scale needs to be done only with the government. Back home in India, I see this happening every time. The polio legacy has allowed Rotary to be taken very seriously by the government of India. Any department, whether we work with the education department or with the health department or water sanitation, any of the departments, they give huge respect to Rotary only because of the legacy of polio eradication. And of course, the legacy of an organization which is spread across the world and more than 115 years old. Rotary in turn, in India, for example, has taken up major initiatives in different types of programs. And I'll tell you why I'm giving the background of Rotary in India. For example, on the matters of literacy, there is a program that we started 6 years back called the TEACH program by Rotary India Literacy Mission. Today, the scenario is that India's literacy rate is only at 76%, but we are committed that over the next 5.5 years, we will take it to more than 95%. What the government not been able to achieve over the last 73 years of our independence, we are committing that over the next 5.5 years, we'll be able to do it, working in partnership with the government. Very recently, while the children, because of COVID, are all sitting at home and not being able to go to school, we realized that these children needed to be able to study even while they were at home. So working with the government has opened up 12 channels on television, 1 channel for each standard. So class 5 children, children who are in standard 5 look at channel number 5, and children who are at standard 8 look at channel number 8. The entire curriculum for those channels has been provided by Rotary. It's a game changer, absolutely. Not only children, 100 million children to start with are going to everyday study because of the content that has been provided by Rotary. Over a period of time, when we translate this into the different languages in India, 250 million children will be able to study because of the work that Rotary has done. So friends, what I'm trying to say is this would not have been possible had we not been working with the government. So partnership with the government, of course, with other NGOs, with other organizations is extremely important, but the most important partnership is with the government. And I'm so happy that the Minister of Health, the Deputy Minister of Health, both are here. And I'm sure the partnership in South Africa of Rotary as well as the government is going to scale up even more. And the work that we do in healthcare will also become a reason for doing similar work in education, in water, sanitation, etc. Apart from education, and back again in India, we are committed that in water sanitation, we are ready to do the equivalent of 10% of the work of the government of India. Of course, Rotary is pretty strong in India, both as far as membership is concerned. It's the second largest country in the world as far as membership of Rotary is concerned. Also, as far as project implementation is concerned, it is at the #1 as far as project implementation is concerned. But I see a huge need in Africa also. So there is tremendous scope for a lot of work being done, as well as membership growth to be done. Let me also take this opportunity. There are quite a few Rotarians from Africa region, and I would say it's very important that Africa increases its membership of Rotary. There is huge potential. The organization is amazing, absolutely. Not many organizations boast that they are 115 years old and they are just this close at the verge of eradicating a disease from the face of earth. Apart from the various other programs, the Peace Centers program, we have churned out over the last more than 10 years, 1,300 peace warriors spread across the face of earth who are trying to build peace in this world, working for positive peace, as well as trying to see that conflict resolution is being done. Not because I am about to head this organization, but I can tell you it's an excellent organization to partner with. Tremendous reach, great network, an outstanding legacy, passion of the Rotarians, passion of volunteers is unmatched, absolutely, and they are focused. And the best example of the focus is that for 35 years, we haven't taken up another corporate program because our eyes are on eradication of polio. RIFA, Rotary Family Health Days, has done some meaningful work in South Africa and the other parts of Africa. They have done in India too. I happen to be on the board, and I was fortunate that for a few years I was on the board, and we brought it to India with huge success. 2 years we had done the program, and now we want to spread it to different parts of India. And once it's done in India, we can take it to Nepal, Pakistan, Bangladesh, Sri Lanka, all of South Asia could be covered. The model is excellent. It is replicable. It has impact measurement, and this is something that can easily be replicated in other parts of Africa as well as South Asia, and in fact any part of the world wherever health facilities are required. While I am here, I would also say that I had mentioned to India, as I said, we do the highest number of grants to the Rotary Foundation. I had committed that while we are the highest recipients over the next 2 years, starting this year and the next year, we would want to be doing many projects outside of India also. And so here is an offer that I'm making to have South African Rotarians that I'll be very happy through Sue Paget to ensure that at least 5% of the grants that Rotary in India is doing will be done inside India, and a major chunk of that could come to Africa region, including South Africa. In the next year, when I head the organization, I have requested the Indian Rotarians to ensure that 10% of the work that they do be done outside India. And definitely the major chunk of that could come to Africa and South Africa. I would request Sue to be able to ensure that these global grants do take place. Let me, even before I end, let me just mention, coming back to COVID, I think the response to COVID also by Rotary has been outstanding. The Rotarians have really rolled up their sleeves wherever they had to work. They worked, whether it was contribution to the foundation, whether contribution to national governments. They have just done some amazing work. The Rotary Foundation itself has given out grants worth about $20 million to countries across the world. Every grant that was applied was provided for, and these are disaster grants that were for $25,000, and then there are other larger global grants that were done. So $25,000 grants were given to as many applications that had come. So the total was about $20 million. Individual countries itself had made huge contributions. I'm aware that in India itself, we did programs and projects worth approximately $30 million, of which $15 million was provided to the government, the Prime Minister's CARES Fund, and $15 million worth of programs were executed at the grassroots level, creating COVID hospitals, providing oxygen facilities at hospitals, providing beds in hospitals, initially providing millions of masks, hundreds of thousands of liters of sanitizers, also providing food at times initially when the neighbors were going back after the containment period. So the work that was done was just outstanding, and I'm sure that's the story across. So whenever a crisis has emerged, Rotary has responded well to it, whether the current crisis or the crisis of AIDS when it was. That's how this program itself had germinated, the Rotary Family Health Days. We are committed to not only polio, not only the Family Health Days, but to COVID and all other programs under health. I would request the Minister, both the Minister of Health and the Deputy Minister of Health, that Rotary would be ready to play a bigger role in South Africa along with the government. And I wish Rotary Family Health Days all the very best, and I look forward to an excellent partnership with the government as well as various other non-government organizations that we have already been partnering. And of course, not to forget the corporates. That's a very, very important part. Together, all of us play an important role. When we come together, there is no disease that we cannot overcome, and there is no problem that we cannot take head on. Thank you very much for inviting me to this event. All the very best. Thank you.
Thank you very much, President-elect, for that insightful input. We have noted with great appreciation a number of lessons that we can take as a critical take-home message for South Africa in particular, as we are resuscitating our essential health programs that were affected by the pandemic, by COVID pandemic. I'd also like to join my co-program director in wishing you a happy birthday and have many, many more.
Thank you. Thank you very much.
Honorable Minister and Deputy Minister and honorable guest, I would also like to recognize and welcome the chairperson of the Portfolio Committee on Health, Dr. Jomo, as well as the MEC for Health in KZN, MEC Simelane Zulu, who have since joined the webinar. Welcome. And also then take this opportunity to invite our Director General for Health to do remarks and introduction of the Honorable Minister. And our Director General is quite a seasoned player in this space, and is a public health medical practitioner with more than 15 years experience in health governance, policy, and program management. After serving as a clinician and later a medical superintendent in various hospitals in KwaZulu-Natal and the Free State Province, he served for 10 years as KwaZulu-Natal's provincial head of strategic health programs, which encompasses the HIV program, the TB, maternal, child and women's health, nutrition, and communicable diseases. Before joining SANAC, Dr. Buthelezi has been South Africa's country director for ICAP at Columbia University, which is a division of the New York-based Mailman Health since 2014. Prior to this, Dr. Buthelezi worked as a senior technical lead for the DFID-funded SARRAH program, which was implemented by Mott MacDonald, supporting the health reforms in South Africa. Amongst others, Dr. Buthelezi has served in the following portfolios: clinicians in various hospitals in KZN and Free State, director of ICAP, health systems and governance specialist, Institute of Youth Development South Africa, and the Foundation for Professional Development Board. During his tenure as the SANAC CEO, Dr. Buthelezi served as the chairperson of the Global Fund Country Coordinating Mechanism. Welcome, Shenge.
Thank you, Dr. Mkhize. I will not do remarks. There's been quite a lot of good remarks, and I would just say all protocol observed. My duty is quite a tough one. If you are expected to introduce your boss, it's always a difficult one. But, you know, as we all know where we come from as South Africa, we've been through a tough time pre-1994. With all the social injustices, this is what drove the person that I'm going to introduce into becoming an activist for social justice, for equity, for equality from his early age. And he was involved in student politics and was the president of the student representatives at the University of KwaZulu-Natal, where he qualified as a medical doctor. Having qualified after that, he saw it fit that he still needed to continue to ensure that all South Africans have got access to good health services, to all the other services that they are supposed to get, and then worked within the country and also outside of the country to ensure that he pushes that South Africa that is not free is not a South Africa that is fit for all South Africans to live in. So after that, he came back and into South Africa and worked again. But we all know that now in 1994, when we all moved on into a South Africa that we were all dreaming of, he became the first MEC for Health in KwaZulu-Natal, the job he did with distinction for 10 years. And we know that even before then, he was involved in preparations for the reforms in South Africa in terms of pulling together the different and fragmented health systems to ensure that we have a unitary health system in South Africa. Because of his agility after 2004, he was appointed the MEC for Finance and Economic Development. Again, in that field, he excelled. And then he was then given the whole province to run from 2009. And he was the Premier of KwaZulu-Natal until 2013. And then he then moved on as the Treasurer General of the African National Congress, the ruling party, the party that brought us to where we are in terms of freedom, in terms of where we are to ensure that South Africans are equal, we get equal services. He served in that portfolio until 2017. And at that time, then he was then appointed by the president as the Minister of Cooperative Governance and Traditional Affairs. Again, because of his agility, he then fitted, you can put him in any portfolio, he will do that job because he's quite a committed and a diligent fighter for human rights. After that, then he was appointed as the incumbent Minister of Health, who's tasked with a huge responsibility. We've all seen internationally, we've received all the praises because of the leadership he has shown in us in terms of leading the fight against COVID-19. We've had the accolades from the WHO. We're not through it as yet, but we know that because of his leadership and also the leadership of our president, we've been able to get to where we are. Dr. Mkhize also serves as the Global Fund board member, the main board member for Eastern and Southern Africa, and serving in the 28-member board of the Global Fund, ensuring that the Eastern and Southern Africa is well represented. The voices of the people are actually well represented in that board. Ladies and gentlemen, please welcome Dr. Zweli Mkhize, the Minister of Health. Thank you.
Thank you very much,
Thank you very much, Director General Dr. Buthelezi, for your very kind comments and introduction. The program directors, Dr. Nhlanhla Makhanya and Dr. Thembisile Xulu, the Deputy Minister, my colleague, Honorable Dr. Phahla, KZN MEC and Chairperson of the Health Portfolio Committee in the National Assembly, Dr. Dlomo and other parliamentarians, the CEO of Action Group for Family Health and AIDS Prevention, Ms. Sue Paget, and thank you for a very lovely speech. Deputy Chairperson of SANAC, Ms. Steve Letsige, Executive Stakeholder Manager for SANAC, Reverend Zoe Neptalo, Country Director for Center for Disease Control and Prevention, Dr. John Blanford, and the Global Rotary CEO, Dr. Ian Burton, Chairperson of the SABC Board, Mr. Bongmusa Makatini, the Rotary International President-elect, Mr. Shekhar Mehta, and let me also take the opportunity to wish you a very happy birthday. And although we've taken your time, but you must know we appreciate the birthday present that you have given us. And thanks for the offer for deeper partnership. Members of the media, partners and colleagues, ladies and gentlemen, today marks the beginning of the 7th annual Rotary Family Health Days outreach program, a massive humanitarian community health initiative that began in 2012. I'm honored to launch this program for 2020. The program achieves the goal of primary health care through public-private partnership, which aims to provide an enabling environment for communities to proactively seek help and be afforded the opportunity to practice preventative health care. The timeliness of this year's program could not be more critical as we emerge out of the COVID-19 surge and refocus our energy towards the attainment of universal health coverage. As a program that has established a broad footprint in our communities, we as the Department of Health welcome this opportunity to kickstart a campaign of rebuilding rapport with our community members and attracting them back to our facilities to test for and manage various conditions such as HIV, tuberculosis, hypertension, diabetes, cancers, etc. Prior to COVID-19, we were already facing a triple burden of HIV, TB, and non-communicable diseases. However, just as we were making inroads through various programs that sought to implement the tenets of our national health insurance, at least in practice, if not in law, the COVID-19 storm descended upon us and disrupted the inroads we were making in the building confidence in the health reform. At this point, over 38.5 million positive cases have been recorded worldwide and over 1 million lives have been lost, even including well-resourced countries. And under 700,000 of those are in South Africa, of which 18,000 or so have lost their lives in South Africa. And we convey our deepest condolences to families and friends. We have quantified these disruptions, and I would like to take this opportunity to share with the public. We're aware that due to the combination of lockdown regulations and the fear of contracting COVID-19 in our facilities, our people shied away from seeking what may have been deemed to be non-urgent or non-essential health services. Excuse me. We're very concerned by the significant declines in numbers of patients who sought medical assistance for the common conditions we have outlined above. Between April and June in 2020, HIV testing fell by 46%. Medical male circumcision had to be suspended and only resumed on the 1st of July 2020. The screening for TB nationally fell by 9% for adults and 14% for children. And the primary healthcare utilization rate by children, for example, access to immunization, fell by 20%. But not only that, COVID-19 has wreaked havoc on the economies of the world, worsening the underlying injustices and inequities in society. Such as significant erosion of GDPs, aggravating inequality, increasing unemployment to levels not seen in the recent past, poverty and hunger, affecting mainly women, youth, children, and marginalized communities. The worst, the disadvantage and underdevelopment
the worse the impact, worsened by poor access to quality healthcare, poor water, sanitation, and overcrowded informal settlement. This has resulted in acute suffering and humanitarian crisis and mental health disorders. The impact on the health of society is badly undermined. It is therefore imperative that we embark on an aggressive catch-up campaign, a drive to ensure that we can capitalize on the infrastructure gains made during the COVID-19 pandemic and get our people back to our facilities and our services back into the communities to continue the good work that was being done as we move towards the attainment of universal health coverage through our national health insurance. As you may be aware, on the 12th of December 2012, the United Nations unanimously endorsed the universal health coverage as a pillar of sustainable development and global security. These commitments were sealed in political solidarity at the high-level meetings on the universal health coverage during the United Nations General Assembly in September 2019. The principle behind the universal health coverage is that no one should be denied access to quality health care because of socioeconomic circumstances, whether be it the individual or state. We must not leave anyone behind. Prior to the COVID-19 pandemic, excuse me, COVID-19 saw us making great strides towards the implementation of the NHI. We had introduced the bill to Parliament in July, and the public hearings had been concluded towards the end of 2019, with the vast majority of South Africans welcoming the public health reform as a long overdue intervention to eliminate the current unjust two-tiered system. Just as we were to begin parliamentary hearing, a storm that brewed in China, with the winds blowing into our direction, forcing us to avert our gaze from those goals and attend to the global health disaster. However, we're determined not to let the proverbial crisis go to waste, ensuring, therefore, that we took every opportunity to adopt some mechanisms and proposals that are contemplated in the bill to manage COVID-19 and stay on the path towards universal health coverage. In other words, as we respond, we kept an eye on what investment will be needed in our future reform. May I therefore take this opportunity to revisit the principles of the NHI, and I hope that there will now be more familiarity in our experience during the COVID-19 surge. The NHI is a healthcare financing system that is designed to pool funds such that there will be one national purchase of health goods and services for all South Africans. There will be no distinction between public and private facility, and every South African will expect to receive the same standard of care regardless of their social standing. All South Africans will share the responsibility of financing the system, and we will cross-subsidize one another in an exercise for social solidarity. Those who are young and healthy and working will contribute towards the fund for the benefit of those who are too elderly, sick, disabled to be able to work. This is the principle that operates globally. We're currently working on a package of primary healthcare services that will be provided under the NHI, and our starting point is to ensure that all services currently provided in the public sector are included. We're also working with the Council for Medical Schemes to ensure that every medical scheme pays for the same package of primary healthcare services that are provided by the public sector. This is part of the process to revise the prescribed minimum benefit that the CMS is working on. Program Director, let us also reflect on the government's partnership with the Rotarians and how it neatly dovetails into our ambitions of attaining universal health coverage. The main objective of our partnership is to provide an enabling environment for health-seeking behavior. The objective is usually realized through bringing services to the people in an outreach format over 3 days. And in addition, the Rotarians are well known for their fight against polio and for the promotion of immunization of children. And we must say we appreciate their contribution at the point where Africa has actually been certified as being free of polio. These services are available in public health facilities for free on a daily basis. Today, I'd like to call on all individuals, families, and communities to take this opportunity to go to their nearest healthcare facility to screen and test for HIV, for TB, for high blood pressure, sugar, or diabetes and cancers and other ailments. If you do the test, if you do test positive for HIV or screen positive for TB or sexually transmitted diseases or non-communicable diseases, you'll be able to treat these illnesses early and enjoy a good quality of life despite the diagnosis. We therefore urge that if you are started on treatment for any chronic condition during this program, that you continue to use the services that government has made available for you so you do not become sick or disabled. That's why we came up with a campaign which we call Cheka Impilo, which is Know Your Health Status. This campaign is designed to remind you that the power of healing is in your hands and that we are here to reach out, guide, and assist you in every way so you can reach your full life potential. As we approach World AIDS Day, we need to remind ourselves that HIV and AIDS is still a pandemic in this country, more threatening than COVID-19. Therefore, I believe we all know why testing for HIV is important. Firstly, knowing one's HIV status will assist in management of the disease if one is HIV positive. You can get treated and live a long and healthy life. Also, if one is HIV positive, one should take care not to transmit the virus to others by adhering to the medication in order to stay virally suppressed and also a protected sex. Last year, we introduced a wonderful new drug called TLD, which is much better tolerated and suppresses the virus even quicker. If you take your treatment well without defaulting, you will remain virally suppressed and with a strong immune system, and this plays a crucial role in protecting you from contracting other diseases, including COVID-19. I must say that in the whole clinician community in South Africa, we were very worried about the impact of COVID-19 on HIV, seeing that we're the largest population of HIV positive people. I think research in the future will still tell us what is it that made the impact to be so self-limiting. Furthermore, consistent and correct use of male and female condoms will also reduce HIV transmission. Both male and female condoms, we call them MAX for the male and Maxima, and for the female, and a compatible lubricant are distributed for free in public health facilities and in non-state facilities. So there's no excuse for not using a condom. In addition to condoms, please continue to reach out to public health facilities for other sexual reproductive health interventions, such as other contraceptive antenatal clinics and counseling for termination of pregnancy. As I alluded to earlier, there was a noticeable decrease in the caretakers and children seeking healthcare because of lockdown or fear of contracting COVID-19. South Africa is one of the countries that is recognized globally for the expanded program of immunization, which contributed to the reduction of childhood diseases such as pneumonias, diarrhea, and elimination of polio, of which we've also been recently certified. So once again, I call on all mothers, fathers, grandmothers, grandfathers, and caretakers not to fear our facilities and to ensure that your children are taken for immunization. I implore our nurses and doctors to warmly welcome all children who may have missed their immunization during the lockdown period so that no one is deterred from visiting the facilities to catch up with their immunization. We remind caregivers it is very important to always bring along the Road to Health booklet, which is also called the clinic card, when you go to a facility, so we can track the progress of your child and quickly pick up any failure to thrive. A full package of services for women, which include contraceptives, cervical cancer screening, pap smear, and testing for pregnancy are also available. For brothers and fathers out there, we also provide male medical circumcision for free in facilities and selected sites. We know from research that men who are circumcised are less likely to contract HIV by 60%. However, this does not render you immune to contracting HIV and other sexually transmitted infections. This is why we still recommend the consistent and correct use of condoms, even in circumcised men in every time they have sex. The Rotary Family Health Days have contributed to the 90-90-90 targets through the provision of outreach testing and referral to the treatment initiation with adherence and counseling. Once we have reached the target of the first 90 nationally, we need to prioritize our targeting in other areas and take the services to the people in order to achieve the second and third targets. To all healthcare workers, let me take this opportunity to express appreciation for all your efforts during one of our toughest public healthcare eras in history. You have persevered, you have fought, you have prevailed, many times going beyond your call of duty to ensure that we emerge victorious, and for that, I thank you. Along the way, we lost some 247 of our frontline workers in the war against COVID-19. I wish to convey my sincerest condolences to the families, friends, colleagues, and communities who lost these precious members of society. May may the souls of our soldiers forever rest in eternal peace, and may we never forget the men and women who laid down their lives in the line of duty. In our midst, we also have the leadership and ground forces of the Rotary, their partners, and our own hardworking officers in the Department of Health. I'd like to congratulate Rotary and all those involved in this great people-driven initiative. I hope that will continue the partnership in the years to come, and that next year your services will not be disrupted by any novel disease. And indeed, we believe that through such initiatives, we become more adept at handling public health threats that could present itself in the future. We do hope that we would have had access to the vaccine and therefore would have started to build our herd immunity, and so we bring back our normal life. We remain proud partners, and I assure you of my utmost support for you and confidence in the wonderful services that you continue to render for our people. Let us all salute all the Rotarians, as well as all our partners, PEPFAR, Global Fund, WHO, UN Family, and all the partners, both global and local. Siyabonga, Enkosi, Realeboga, Inkosi, Baya Danki, Merci beaucoup, Roribua, Shukran, Asante Sana, thank you. Finally, it's my privilege and honor, as delegated by the Honorable the Deputy President of the Republic of South Africa, Honorable David Mabuza, in his capacity as the chairperson of the National AIDS Council, to launch the theme for the commemoration of World AIDS Day 2020. The global theme as set out by UNAIDS for this year is, and I quote, global solidarity, shared responsibility, unquote. It calls for greater solidarity and collective responsibility amongst nations to take measures that end HIV and AIDS as public health threats. This theme also suggests that unless we work together for a common good, our efforts will forever be in vain. This is one lesson that we have learned on the fight against COVID, that in the search for vaccine, we have made a call that no one is safe unless all of us are safe. It's against this background that South Africa will commemorate the World AIDS Day under the theme, and I quote, "We are in this together, cheka impilo," unquote. This is an earnest call to all South Africans to make responsible health choices. Both the national and global themes acknowledge that the success of any public health system depends on the collaborative effort and the joint responsibility where individuals, communities, authorities, and partners work together. Ending AIDS requires communities to be placed at the center of the response so they can help address challenges specific to them. Communities need tailored and targeted interventions and not a one-size-fits-all approach. As we count down to the World AIDS Day 2020, we call on communities, leaders, faith-based organizations, traditional leaders, traditional healers, nurses, doctors, pharmacists, and all allied health workers, mothers, fathers, grandparents, learners, teachers, political leaders, business people, teenagers, academics, scholars, and all members of society in their roles to come and play that role and then say, we are in this together, cheka impilo. We can eliminate HIV and AIDS, and therefore, with that partnership, we will remain formidable and we will be able to conquer whatever we come across. I thank you. Thank you very much.
Thank you very much to the Honorable Minister for that very clear roadmap towards the realization of universal health coverage. We've seen with the COVID-19 outbreak that there has been a significant reduction in health-seeking behavior, and we have indeed lost some ground on the gains that we had made. So thank you, Minister, for the firm commitment to an aggressive catch-up plan and to the rebuilding of the rapport with communities. And we certainly commit to welcoming back our communities to our facilities. As the Minister has clearly stated, the objective of this partnership is to create an enabling environment for health-seeking behavior. On behalf of the Sanak family, which leads the commemoration of World AIDS Day, I'd also like to thank the Minister for launching the theme for World AIDS Day, aligned to the global theme, which is global solidarity and shared responsibility. We are saying as South Africa, we are in this together, cheka impilo. So as South Africans, ours is now to give meaning to this theme. So siyabonga kakhulu Khabazela, Ngunezi, Gwabeka Ihlandla kuphela. The COVID pandemic has certainly shown us that we are led and together we can. This is where my duty and Dr. Makhanya's duty ends as program directors. And I'd really like to thank you for giving us this opportunity. On behalf of the Rotaries and the partnership with the department, let me welcome Reverend Zweli Mkhize, who is an executive manager for stakeholder management and campaigns at the South African National AIDS Council, to come and give us a vote of thanks. He's fondly known as Reverend Zweli and has got experience, extensive experience in corporate governance and leadership, and he serves on many boards and board committees. Rev, thank you so much.
Thank you very much. I'm not sure if I'm audible or I'm...
Yes, we can hear you, Rev.
Okay, thank you very much. Program directors, let me start by saying all protocol observed. It is an honor for me to propose a vote of thanks for the great contribution of the Rotarians and their dedication in joining the efforts of the country under the Department of Health in the provision of much needed health services to mostly vulnerable and marginalized communities. I remember the first campaign in the informal settlement of Zandspruit. It was at a place where, when one drives in, tracker sends in warnings and continuously inquired whether you and the vehicle are safe. Yet this was the place and setting where Rotarians agreed to have their national launch way back. I remember, I think it was in 2012. Program directors, this to me underscored the passion, commitment of Rotarians to make a difference in the health profiles of communities most disadvantaged. This theme has been consistent throughout the years as the Family Health Days moved from province to province. We in SANAC usually struggle to mobilize partners to join the country's efforts to expand the HIV, STI, and TB services. But for Rotarians, we have seen a ready and passionate partnership sustained over a number of years. This year, these programs, like many others the world over, has been impacted by the COVID-19 pandemic. However, we are most thankful that today Rotarians managed to work with all of us to organize this epoch-making webinar. We would like to thank all the speakers, without which this webinar would not have made the resounding impact it has. It was very clear that every speaker treated the invitation with all the seriousness it deserved. Let me thank the two ably program directors who ably directed our program, Dr. Mkhize, and our brand new CEO, Dr. Tulu. We normally call her in the office, Dr. T, for the efficient and professional manner in which they directed this program. Minister Mkhize, we are aware of the pressure that you and your deputy are daily subjected to as you work around the clock to ensure that South Africans receive quality health services and healthy long lives, irrespective of their status in society. We thank you both for having made the time to be here this evening. Thank you very much for launching the South African theme for Well AIDS Day 20. You have given us marching orders. Lessons from COVID-19 are very clear. We are indeed in this together. We are also grateful to the DG and his team that worked behind the scenes to make this a success. Ms. Litike, thank you for bringing the voice and commitment of civil society to this important platform. Many thanks to all the other speakers, Dr. John Blandford from CDC, and the many others who contributed to the success of this program. Ladies and gentlemen, imagine us here in the southern tip of the African continent, and we were in this webinar addressed by the whole president-elect of Rotarians all over the world. Thank you very much for your message. And I need to echo a happy birthday to you. It was a message of solidarity with us and the many people who benefited and stands to benefit from the implementation of the Family Health Days in the future. Many thanks to Sue and your whole team. I'm certain that today you are relieved that the many hours you put into this seminar were not in vain. Please do convey our thanks to the many partners that we have mobilized to join the Family Health or Health Days. Program directors, in many of the African funerals that I have attended, the item of vote of thanks becomes a catch-22. You keep it brief, then you leave others from the list of people you need to thank. And if you try and thank everyone, then you delay the mourners from moving on to the item of washing of hands. So program directors, let me end by thanking all those people who joined in from many places into this webinar. It is those who patronized this webinar who made it a success.
much.